Hello, this is Congressman Phil Gingrey from Georgia's 11th Congressional District. Today marks the one-year anniversary of the Patient Protection and Affordable Care Act, sometimes known as Obamacare. States all across this country are suffering tremendously because of the effects of many provisions of this bill, not the least of which, of course, is the expansion of the Medicaid program. In fact, there have been two court rulings, one in the Commonwealth of Virginia, the other in the state of Florida, joined by 27 other states, including our own of Georgia. And the ruling was that clearly this law, in part or in total, in the Florida case, was unconstitutional because of a provision that requires individuals to in fact mandates them to purchase health insurance even if they can't afford it and even if they don't want it under the rules of the Commerce Clause. So you can see that the opposition, when you do polling, Rasmussen in its most recent poll, and it's been a year since the passage of the bill, some 67% of American people join those states and say, we don't want this bill, we never did want it, we don't want the federal government to take over health care. I joined with my 17 doctor colleagues and 3 registered nurse colleagues of the House Republican Doctors Caucus in continuing to fight for the repeal of Obamacare. In fact, in this 112th Congress, one of the first things we did was pass House of Resolution Bill number 2, the repeal of this job-killing so-called Health Care Reform Act. This passed the House in a bipartisan vote. It's now in the Senate. Of course, the Senate is controlled by the majority of Democrats, and so far we have not been able to get that repeal bill passed. But we will continue, you have my pledge, that we will continue to work diligently to make sure that we chip away at various sections and aspects of this bill, whether it's striking sections or defunding sections. Defunding is a certain project that we are working hard to accomplish before the full effects of this bill take effect in 2014. I think that would have devastating effects on our economy, and as I say, in the repeal bill, it is a job killer. We are very much in favor, those of us who have practiced medicine, in fact I did for over 30 years, we know that there needs to be reforms in our healthcare system, particularly in the health insurance industry. We're not opposed to letting young people stay on their parents' health insurance policy till they're age 26, but quite frankly, they wouldn't have to do that if we would stimulate this economy and try to devote and direct our attention toward getting people jobs when they get out of high school or college. They wouldn't need to be staying at home and being on their parents' health insurance policy. They could afford one of their own. So Medicare, Medicaid, all of these programs are very important. We will work to make sure they are secure and improved and sustainable. So I thank you very much for your continued support on this. We look forward, of course, to being in the district soon, but we're going to fight every step of the way until we finally and fully repeal this bill and replace it with something that actually does bring down the cost of health care and allow more people to be insured. Thank you so much.